Hello everyone, this is Dr. Rahman. I'm an endocrinologist. Welcome to District Endocrine. Today we are going to talk about osteoporosis. This is a two-part video. In one first part we're going to talk about osteoporosis, and in the second part we're going to focus on the treatment. So let's get right into it. The first question is, what is osteoporosis? Well, it is a disease that affects bones and makes them weak. It means that you have less bone mass and less bone strength. The word osteoporosis means porous bone. It does not cause symptoms or pain unless there is a fracture. The most common fractures include hip, back, or wrist fractures. This is a common cause of height loss in elderly patients as well. It is estimated that more than 50 million people in the US have osteoporosis, the disease which can occur both in men and women. However, it is most common in postmenopausal women. Now, at the age of 50, at least after that, more than half of the women and one in every fourth man will have osteoporosis related fractures in their lifetimes. Majority of the people will have osteopenia, which is other than this 50 million people who will have a condition which is weak bones, but it is not as bad as osteoporosis, and they are at risk of developing osteoporosis basically. Now I'm going to talk about what are the risk factors or the causes for osteoporosis. Now, there are several risk factors that develop or increase your risk for developing osteoporosis. Bones are living organs and they are continuously growing. These bones are made from two parts, which is the sponge-like internal area called trabeculae and the outer shell, which is the hard piece of the bone, which is called cortical bone. With osteoporosis, there are holes in the sponge which grow larger and larger, and then it can lead to weakened bone structure, just like Swiss cheese. Now, this structure, which is now weak, is called osteoporosis. Basically, bones are also, they store calcium and other minerals, which are utilized if needed in the body. Because of this process of storing and then reutilization, which can be labeled as rebuilding and remodeling of the bones for the calcium storage, this is an ongoing process and it actually results in stronger bones. So this explains why do we need all these minerals and the calcium for the bone health. With women's reaching their age of 50 years, their bone starts to get weak and they start to lose their bone mass. And they are more prone to osteoporosis because we do need estrogen hormone for helping to keep the bone strong. Well, next thing we're going to talk about is the symptoms related to osteoporosis. As I said earlier, usually there are no symptoms. It is considered as a silent disease. However, we need to look for some silent risk factors related symptoms and signs. So, for example, height loss up to an inch or more, change in posture, shortness in breath due to decreased lung capacity, if you have fractures or issues going on with the rib cage, or back pain coming out from possible hidden back fractures. Sometimes you don't really have to feel a trauma in order to see if you have a fracture. So people with age more than 50, there is increased risk of osteoporosis both in men and women. It is more likely to be in the women, especially being menopausal after the age of 50. Certain ethnicities have more risk of developing osteoporosis, such as Caucasian or Asian. However, African American and Hispanic women are at increased risk. Literature shows that African American women are more likely to die from an osteoporotic hip fracture than a Caucasian woman. We know that the obesity rate is increasing, and obesity increases your risk for developing osteoporosis by reducing your risk, reducing bone mass. Obesity also affects the absorption of vitamin D, which can also make things worse. Family history is important. If you have parents or grandparents who have osteoporosis, your likelihood of developing osteoporosis is high. Research shows if your mother had a hip fracture from osteoporosis, the likelihood of you developing osteoporosis also increases significantly. There are several medical conditions which can increase your risk for developing osteoporosis. Now, these medical conditions include several hormonal problems, such as if you have hyperthyroid, which is overactive thyroid disease, if you have a parathyroid disease where your parathyroid is overactive, or if you have undergone weight loss surgery, or if there is a drastic weight changes, patients with organ transplantation, or those patients who are on organ transplant transplant medications, if you have an inflammatory bowel disease or celiac disease, multiple myeloma, or if you have been treated for breast cancer or prostate cancer with hormone therapies, or in females if there is a disease affecting their monthly periods. Now these are very common ones, but there are several other diseases which can affect your bone health. We also know certain medications such as steroids and the medications used in the treatment for breast and prostate cancers, as well as the seizure disorder medications, increase the risk for osteoporosis. Steroids treatment as little as 3 months can lead to osteoporosis and fractures. So that is something you definitely need to talk to your doctor if you are prescribed steroid for any reason, such as lung disease or any rheumatological conditions. Lifestyle dairy habits, for example, patients with chronic calcium and vitamin D deficient diet, those who do not take any dairy products, are at risk of developing osteoporosis. Eating disorders such as anorexia or bulimia can increase risk for osteoporosis as well. Tobacco, smoking, cigarettes have been associated with increased osteoporotic fractures. If you're drinking more than 3 drinks of alcohol, you're definitely increased risk of having fractures from osteoporosis. Thank you so much for watching another episode of District Endocrine. This is Dr. Rahman signing off. Please don't forget to visit our website www.districtendocrine.com. And a disclaimer, there is no sponsorship or any conflict of interest for this particular video. Don't forget to like, subscribe, and share. Thank you very much.